that we're going to be charting on and taking care of for the day. So I did that, and we have the right baby. So next we're gonna undress the baby a little bit here so we can get the vital signs, and we like to do that first because we don't want the baby to get upset and the vital signs would be off than what they normally would be. So first we're going to take the temperature, and I'm going to use this pencil to simulate that. We put it right here, and we like it parallel to the body, and we like to do it axillary. So we do it this way instead of this way. So we're going to do that, and sometimes it takes a couple of minutes. So I've taken the temperature, and it's good. The normal temperature for a newborn is going to be 97.7 to 99 degrees Fahrenheit. Next, we're going to assess the baby's respirations. So we're going to place a hand on baby's tummy and chest and go ahead and count that. We need to do that for a full minute. And I've done that for a full minute, and the normal respirations for a newborn are going to be 30 to 60 breaths per minute. Next, we're going to go ahead and check the baby's heartbeat. So we like to warm our stethoscope first a little bit so that it doesn't startle baby. And we're going to take the apical heartbeat. And you do that for a full minute as well. And I've done that for a full minute. The normal heart rate for a baby is going to be about 100 to 160 beats per minute. So that went well. Next, while we're still on the baby's chest, we can go ahead and check for heart sounds and breath sounds in the lungs. So we want a nice normal rhythm to the heart. In newborns you could hear murmurs, which sounds like a swishing sound. So that sounds good. Now we're going to assess for breath sounds. We just do that right above the nipple line here for the upper lobes. And we're just looking for any cracking, wheezing, any of those abnormalities. Sometimes the newborn will have crackling in the lungs from just leftover amniotic fluid in there. So we just definitely want to assess for that. And we like to do it right here on the side for the lower lobes. Alright, that's good. Baby had normal breath sounds. So I would chart that. Next, we're going to assess for bowel sounds. So we do that with our stethoscope. We're going to check all 4 bowel sounds and note any abnormalities. And the 2 upper quadrants are above the umbilicus, and the other 2 are below. And this baby's bowel sounds are normal or active. There's 4 kinds: absent, active, hypoactive, and hyperactive. So now that we've done that, we're going to cover baby back up and assess the baby's head. So we're going to take the cap off. And first, we're going to assess the fontanelles. There's 2 fontanelles, anterior and posterior. Anterior is diamond shaped, posterior is triangular shaped. We're just assessing to see if there's a depression here, could be caused by dehydration, or any edema or swelling here. And this baby's is normal, so that's good. Next, we're going to assess the suture lines here. We're just trying to see if they're separated. Sometimes they can be overlapping or widely separated. This one's normal, so that's good as well. And we're also going to look across the suture lines here for any caput succedaneum. and it's going to look like raised. We're also going, and that crosses suture lines, by the way, the capsule succedaneum does. And we're also going to look on one side or the other of the fontanelles to see, I'm sorry, not fontanelles, of the suture lines to see if there's any cephalhematomas. And there's not, so that's good as well. Next, we're going to assess the baby's skin on the face. It should just be clear and nice and smooth. Normally, sometimes we can see milia, which are kind of like little pimples here on the cheeks or nose. We can see strawberry marks, stork bites, any of that. So this baby's skin. Next, we're gonna assess the eyes. We're gonna look for any discharge in the eyes, yellow, green, etc. Just looking to see if there's maybe any possibilities of infection. Next, we're going to assess the symmetry of the eyes, and we're going to use the third rule. We go from outer canthus to the nose, and that should be a third. The bridge of the nose should be a third, and the other eye to the outer epicanthal fold should be a third as well. Next, we're going to look at the inside the eye very gently. We're going to open it and look in the sclera and make sure there's no sign of redness. Looking for a subconjunctival hemorrhage. And we're also going to look here in the inner canthus of the eye and see if we can see any epicanthal folds, which are normal in the Asian descent, but it could be indicative of any Down syndrome or other abnormalities. So now that that's done, we're going to go ahead and take a look at the ears. So we'll just slip the cap up here a little bit. First, we're going to check for patency. We're going to fold the ear down, the top of the ear down, and let go and check for recoil. We're also going to do it sideways here to the cheek and check for recoil as well. We're also going to check the position of the ears in regards to the eyes. So you just draw an imaginary line from the inner canthus, to the outer canthus, and go straight to the ear. And sometimes if there's an abnormality or the baby has Down syndrome, the ears could be lower set. Next, we're going to look at the nose, check the patency here. And babies are obligatory breathers, and when they breastfeed, they should be able to use one nair to breathe out of. So we're just going to gently close one shut and observe for air out of the other. And do the same as well, shut the other nair and check for air coming out of the other one. Next, we're going to turn our attention towards the mouth. We're going to check for the rooting reflex, touch the cheek, and the baby should turn her head, and the other cheek, and she should do the same here. We're also going to check for sucking. So an easy way is just to do the rooting, and the baby normally will easily let you put your finger in her mouth and suck. And you also want to check the roof of the mouth, check for any abnormalities. It should just be smooth and a little bit harder. Next, we're just going to look here at the neck and palpate gently, just looking for any masses or lumps. And we're also going to check range of motion here. So we're just going to gently help baby turn her head to the side, back up, and to the other side. Next, we're going to take the baby's onesie off here and assess the skin. So while you're taking it off, you can look for any rashes, any bruising from birth. You can also look for and assess and chart if there's any vernix, which is the cheesy white substance. You can also look for lanugo, which is hair, We're also going to check for skin turgor. You can either, we'll do here on the thigh, just do a little pinch and assess for how fast or slow it goes down. Also, you want to note the baby's clavicles. Make sure they haven't been injured and they're still intact from the birth, even the birth canal if they had any injuries. When you look at the skin, you're also going to check for jaundice. So first we assess the forehead and just blanch lightly, and the chest and blanch lightly as well, abdomen, thigh, and then we're also going to go back to the eyes. And since it happens in a cephalocaudal manner, the baby would be jaundice first in the head, go all the way down to the toes, and then the eyes would be yellow. So just look in the sclera rather, and see if it's red. Not red, yellow. And that's what you were assessing for the skin as well, seeing if it's yellow. Next, we're going to assess for signs of respiratory distress. We already did the breath sounds, and those signs are going to be any grunting, any retractions here in the ribs, any nasal flaring, and you're also going to look for seesaw respirations, which is when the baby breathes in a seesaw manner, such as the chest rising and the abdomen falling, and vice versa. And lastly, you're going to check for apneic episodes, which is defined as 20 seconds or more where the baby's not breathing. So after that, you're going to go ahead and check the baby's abdomen here. You're just looking for a nice soft abdomen. You don't want the belly to be distended or sunken. So next, we're going to check the genitalia, and I'll turn the baby this way. So just gonna tuck the diaper under there like that. Here we have a female, so we're gonna be looking at the labia majora, seeing if that covers the labia minora, which it normally does, in the clitoris. If this was a male, you would be checking the testes, seeing if they've descended all the way. You would be checking for rugae, and that's the rugae will tell you kind of like the gestational age. If there's more or less, it's either way. And you'll also be looking at the foreskin. So that's normal, and you would obviously change baby's diaper. And in the female here, you would check for any discharge. Sometimes there would be like a white creamy discharge or maybe some blood, and that would be normal, and you would wipe that off and change the diaper. So after that, get the diaper back up and make sure that there's no discharge as well in the cord where the umbilical cord is. Any bleeding, and assess for dryness as well. And we no longer use the alcohol pad for that. We're going to cover baby back up to keep her warm, and we're going to assess for tone in her arms and recoil here. So we're just going to bend the baby's arm up all the way, hold for 3 seconds, bring it back down, and assess for the recoil. It should be that she brings her arm back up. While we're up here, we're going to look at the palm of her hands and look for the creases, and we're mainly paying attention to see if there's a single palmar crease, which sometimes is indicative, of Down syndrome. We're going to make sure she has all 5 fingers here and here, and we're also going to look for wetting in between the fingers. So next, we're going to go to the feet and assess for creases as well as digits. Put our cap back on to keep her warm. So